Hi, good evening. I'm Dr. Philip Macmillan. Thank you for joining me as I break some very concerning news in the sense that we've gotten information from the former CDC director, and I'll be playing a clip and discussing some of the points that he has highlighted in the clip that are upsetting in the sense that we needed the scientific community to come forward and state these facts so that we wouldn't get caught in the narrative around COVID 19. Facts are facts, science is science. There is no easy way to get around it. And so, my hope is that we will move to a place, especially when we have so much distrust in science at the moment, that we can be honest about what is going on. So I've got here a number, just one clip from the chief nerd on X, and I'll be using this clip to make a few points about what I think was important to be said and is now being said by the former CDC director, Mr. Robert Redfield. So let's just listen to what he had to say at the time.
I mean, I was upset with CDC when I left because they stopped tracking people that were infected that were previously vaccinated. So if you
Why?
didn't track it, well, because then you couldn't report that there were people vaccinated that got infected.
I'm just going to pause that there for a second because that is really, really very important. Early, it was very clear that people who were vaccinated were still getting infected. And it was important to highlight the fact that the vaccines didn't block transmission or only reduced it temporarily. That would have prevented the huge error of vaccine mandates. And you can see the amount of people who lost jobs, who were restricted from travel, simply because the science was put on the back burner because of politics and probably finance. The good question is why? Why would they have done that? What was the reason? What was the principle? What would they have gained from being able to say that the vaccine would have reduced severe disease for a period of time, but not had that much of an impact on transmission? Why was it so important that that truth remained hidden? Let's continue with what he had to say.
No, why did they stop tracking it?
But I think there was a decision not to do anything that made the vaccine sound like it didn't work. You know, I've always tried to be honest that I think there was some major mistakes in the vaccines. They should have never been mandated. I also felt that people should have been more honest about the fact that there were side effects to those vaccines, and some people were actually harmed. The other thing I thought there should be, more honesty about the fact that the vaccines don't protect against infection. I remember Biden saying, this is an epidemic of the unvaccinated. When I was Hogan's chief public health advisor in Maryland after I left CDC, I was saying, wait a minute, 2/3 of the people that I'm seeing infected in Maryland have been vaccinated. I mean, the president of the United States said it.
Again, I have to pause it here because it comes back to the fact that everybody heard that kind of information. But the reason the public trusted it was because there seemed that there was no one significant who was coming out against it. The voices like myself, who was saying that was not scientifically correct, weren't counted as significant because I was just one fringe voice. Many other people were taken off platforms for saying similar things. There was no intention to follow the science. And you just have to keep asking who benefits? Why would it be that the science was such on a back burner? When you realize the amount of financial compensation that went to institutions like the NIH for the vaccine rollout, we're talking over 700 million US dollars. You then can begin to understand what could be the mechanisms or the reasons why people would do this. Let's continue to listen to what he had to say.
Biden said this was an epidemic of the unvaccinated. Tony wasn't aggressive in putting this in perspective. The CDC didn't put it in perspective. The reality is this vaccine, listen, it's a short duration in which this vaccine provides some efficacy, maybe 4 to 6 months max.
I have to pause that right there here again. How is it possible from a scientific point of view? And again, you must ask people who are very pro what we have done over the pandemic. Ask them if they understand the science. How is it possible that you have a vaccine that would protect for only 4 to 6 months? Now, you have to remember that the antibody levels were still pretty high. We're talking about 10 to 20 times higher than a normal infection. So it wasn't because there wasn't an immune response. What would have been the mechanism? 20 to 30% still getting infected with exceptionally high antibody levels. It really raises the question, was the therapy, and this is why I'm saying it in such a way, was it acting more as a therapeutic than a vaccine? Because in a vaccine, it primes your immune system to therefore fight an infection in the longer term. Was this operating in a different mechanism? And which is why so many boosters are required, because it's primarily a therapeutic. That's a really important question that needs to be answered scientifically. Let's listen to what else he had to say.
If you came down and visited me and interviewed my patients, you'd interview patient after patient after patient that did not have COVID, but are very sick.
Right.
You would say very sick long COVID patients, and it's all from the vaccine. Now, what is it, Chris? Well, it's the spike protein is immunotoxic. All right, when you get infected, it's immunotoxic. But when you give the vaccine, we make the spike protein. Now, this is my opinion, okay? When I give you an mRNA vaccine, which I helped develop, and I've given to a lot of patients, and I've taken it myself multiple times, I don't know how much spike protein you make.
Right.
Pause right there. They must have been listening to our interviews, because this is exactly what Susan Langlois had said, who was a retired pharma vaccine developer. And this is exactly what she said. And it was one of the reasons why she completely disagreed with giving it to children at the time, because she was saying, you don't know how much spike protein is going to be made. A really obvious question, because each body's metabolism is different. And so therefore one person could make the exact amount you expect. What happens if somebody makes 10 times the amount, or somebody who makes only a quarter of what you expect? These are all very important questions that have always been there, but for the purposes of the pandemic, it seems logic has been lost. Let's listen to what else he had to say.
Because I give you mRNA and then your body makes it.
Right.
So you make a little, you may make a lot. You may make it for a week, you may make it for a month. I'm now more of the point of view, and I wish the country would switch more rapidly. I'm more of the point of view, and in my clinical practice, I use the protein vaccine. So I know exactly how much spike protein you get. Your body's not becoming a manufacturing plant.
Right.
Okay.
I will pause him again right there. Now, this is where you take one error, you acknowledge it, but then you compound the error. He just said the critical point. The spike protein is fundamentally the problem on the virus and everything else. It's immunotoxic in that it triggers the immune system to overreact. Whatever form you give it in, it's just a question as to how badly does it cause the immune system to overreact. And this is why we have been focused on autoimmunity and the risks of autoimmunity going long term. But again, let's continue to hear what he had to say.
I give you a certain amount of spike protein that's not able to replicate, not able to reproduce itself. And I know the decay curve in the human body. And that's the vaccine I use now. It's made by Novavax. I think it's, in my view, doesn't have all the nuances that we don't understand about those individuals that looks like there's prolonged production or impact or negative consequence from spike protein in some people that get the mRNA vaccine. It's still rare, but it's real.
So
I mean, I was
again,
upset with
we have
CDC when I left
pause
because
that
they
there,
stopped tracking people.
and just make the point, which is that there is now finally that recognition that there are problems. This is what anyone who was looking objectively at the science was asking. What were the risks? What were the benefits? And this is why I wasn't arguing that you should never use the vaccine. At the time, and I still maintain early in the pandemic, targeted vaccination to who? People who were high risk, who had not been exposed. If we had done that across the world, not just in the first world countries, and then let herd immunity get to the whole population and used early treatment to treat those who you couldn't anticipate would have gotten unwell, that's through interferon autoantibodies, the pandemic would have been over. Where we are now is a frightening compilation of issues. Not only is the whole population immune primed to this virus, but they can't stop the circulation. Their immune system is locked into responding to the original virus. And so we have ongoing circulation of Omicron, which keeps on triggering the immune system and therefore has a risk long-term around autoimmunity. That's just the sad reality. It's what is where we are. We have to accept this. My problem is that it's only now starting to be acknowledged. Do we have any opportunity still for mitigation? That is the big question. Remember to subscribe. Look in the description below to see all the links to all of our courses and our search engine to search our videos. Have a great evening.